Let's learn about diabetes mellitus, focusing on patient education, self-care, and oral hypoglycemic drug classification. In this video, we will understand how patients can manage diabetes through proper diet, regular exercise and lifestyle modification. We will also discuss the classification of oral hypoglycemic drugs used in diabetes management. Let's discuss patient education and self-care in diabetes mellitus. Education and self-management goal setting should be provided to individuals diagnosed with diabetes and prediabetes. Understanding the condition helps prevent complications and improve overall health. Self-care mainly includes lifestyle changes such as healthy dietary habits and regular physical activity. Lifestyle changes in diabetes mellitus can be difficult to maintain. Positive reinforcement and family support help improve motivation. Involving the person with diabetes in decision-making also increases confidence and adherence to treatment. Now let's talk about medical nutrition therapy, or MNT. It is a structured nutrition care process that includes assessment, education, goal setting, and evaluation of outcomes. The main aim of MNT is to help individuals achieve and maintain optimal metabolic control. This includes maintaining healthy blood glucose levels, lipid levels, and blood pressure. Through proper dietary planning and continuous monitoring, it plays a key role in effective diabetes management and prevention of complications. Previously, the exchange system was recommended to help regulate blood glucose levels. This method was based on the amount of carbohydrates present in different food groups. However, this strategy has now been replaced by more practical approaches such as carbohydrate counting and the plate method. These newer methods are easier to follow and help individuals better manage their blood glucose levels through proper portion control and balanced meal planning. Now let's move to the next components of diabetes self-care. B. Physical activity. Regular physical activity plays an important role in controlling blood glucose levels and improving overall health. C. Prevention, recognition, and treatment of acute hypoglycemic and hyperglycemic episodes. Patients should be aware of how to prevent, identify, and manage both low and high blood sugar levels to avoid serious complications. D. Reduction of modifiable risk factors. Reducing modifiable risk factors helps prevent chronic complications. This includes achieving glycemic, lipid, and blood pressure goals, quitting smoking, and reducing weight when necessary. E. Pattern control. Pattern control helps individuals understand how illness, diet, stress, and physical activity affect blood glucose levels, allowing better maintenance of glycemic goals. And now, let's understand the implementation of specific self-care measures in diabetes management. It includes foot care, dental care and eye care. Foot care. Individuals with type 1 and type 2 diabetes may develop peripheral neuropathy and peripheral vascular disease, which increase the risk of lower extremity complications and amputations. Proper daily foot care helps reduce these risks. Dental care. Maintaining good oral hygiene and regular dental checkups help prevent infections and gum problems. Eye care. Regular eye examinations are important to detect and prevent diabetes-related eye complications. Now let's understand oral hypoglycemic drugs. Oral hypoglycemic drugs are medications that help lower blood glucose levels and are effective when taken by mouth. One major drawback of insulin therapy is that it must be administered by injection. Because of this, orally active drugs have always been sought as a more convenient and patient-friendly option. These medications play an important role in the management of type 2 diabetes mellitus. Oral hypoglycemic drugs are classified into different groups. First, drugs that enhance insulin secretion. This group includes sulfonylureas cap channel blockers divided into two generations. In first generation it includes tolbutamide and, in second generation includes glibenclamide also known as gliburide, glipizide, gliclazide, and glimepiride. 2. Meglitinide, phenylalanine analogs it includes ripaglinide, nataglinide 3, glucagon-like peptide 1, GLP-1, receptor agonists, injectable drugs, such as exenatide, liraglutide. 4. Dipeptidyl peptidase 4, DPP4, inhibitors it includes sitagliptin, vildagliptin, saxagliptin, alagliptin, linagliptin. Second, drugs that overcome insulin resistance. This group includes biguanides like metformin and thiazolidinediones such as pioglitazone. Third, miscellaneous antidiabetic drugs. These include first, alpha-glucosidase inhibitors like acarbose, miglitol, and voglibose. Second, amylin analog it include pramlintide. Third, dopamine D2 receptor agonist it include bromocriptine. Finally, sodium glucose cotransport 2, SGLT2, inhibitors such as dapagliflozin. Disclaimer. This video is created for educational purposes only. The information provided is not intended to replace professional medical advice, diagnosis, or treatment. Please do not self-medicate. Always consult a qualified doctor or healthcare professional before starting or changing any medication. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe for more educational content.